911 gets dialed for all sorts of emergencies and sometimes non-emergencies. The University of Chicago's Health Lab is working with community members to see how the nation's emergency response system can be transformed to better serve people in crisis. They say 911 calls should be reframed as a public health issue and not one of law enforcement. Joining us to discuss this initiative is Rebecca Neusteter, Executive Director of the Health Lab at the University of Chicago. Rebecca, thank you for joining us. So first, tell us a little bit about how we use, maybe we overuse or misuse 911 today, but tell us more about that.
Yeah, thank you for having me, Brandis. We think of 911 as a part of our system that has been in place forever, and it's really only about a half of a century old, yet it's one of the most heavily relied upon systems that we have. It represents one of the most effective public service campaigns in that, you ask a child over the age of maybe 2 or 3 what to do in the case of an emergency, and they tell you to call 911. But what has happened is that as a result of the way that the system was designed, we made a concerted decision to couple care with enforcement. And as a result, what happens is that some people never seek care because they fear enforcement, and other people who are in need of care receive enforcement in lieu of or in addition to care. And this initiative really is trying to reframe 911 as the public health and care service model that it should be.
And on that note about, some people not calling 911 because they are afraid of the kind of support that they may or may not get on the other end of that call, how are communities of color disproportionately impacted or impacted at all by the use of 911?
Communities of color, like in many issues that face us, there are issues of systemic racism in which communities of color are both over and under protected. 911 will serve communities of color in ways in which people will call and ask for assistance, but also will not respond necessarily in the ways that are needed. There are countless cases in Chicago and beyond where family members of people of color will call 911 seeking for care and assistance, specifically asking for paramedic and other sorts of ambulatory care, and the police are sent in lieu of what families are asking for and requesting. While at the same time, community members are looking for safety and care, but that those calls for well-being are not responded to in order to ensure that the right responder is responding at the right time, which doesn't necessarily mean that you need the quickest response. Oftentimes, the fastest response isn't the best response. We know that in many cases in our lives, and that many of the issues in which people are calling 911 are not manifestations that occurred instantaneously and require longer-term well-being and care in order to be supported for communities, particularly communities of color and communities that have been disenfranchised from well-being and care.
Rebecca, how would you say the current 911 system across the country is structured, and what are some of the limitations of it?
One of the biggest challenges in terms of 911 is that there's no one way in which it's structured. 911 is composed of about 6,000 different what we call public safety answering points, or PSAPs. They're governed completely differently, and we have not invested in them to make sure that they're not only high performing, or that we know very much about them. It's very much a black box. In most cases, people don't really know who operates their 911 center or their PSAP in local communities. We're trying to sort of open up that information and that black box through the ability to access information through our website, which is transform911.org. And there are other resources in which you can look at to find out where your PSAP is, and to determine whether or not your 911 center is a function of a police department, is a regional authority. And in some instances, 911 centers, to many people's surprise, are actually private entities that are run by for-profit corporations.
How might, for example, someone in a mental health crisis be better served or differently served through some sort of reimagined 911?
Ultimately, we do not think that there should be any wrong door towards care. And what we'd like to see is that there are more supports and better professionalization in terms of call taking. Call takers do an absolutely extraordinary job under very difficult circumstances, but it's a profession in which we've undervalued and underinvested in the workforce. So in pretty much every 911 center that I'm aware of across the country, there are incredibly high levels of attrition, which means, and there was a story that just came out of Philadelphia over the weekend, that calls are going unanswered because there isn't the workforce to answer them. And that those calls then are being answered and dispatched as quickly as possible, rather than taking the time to understand what the fundamental underlying needs are that people have, and to ensure that then the right responder is dispatched at the right time, rather than defaulting to police response when that may not be, in fact, the best response. And when police are deployed to calls for non-criminal matters, there's a risk that the situation can escalate.
Rebecca, we've got about 30 seconds left, but what could the end result of this project look like?
Yeah, ultimately what we want to do is we want to invest in the very front end of the system to ensure that call takers have the resources that they need in order to make sure that they understand the problems at hand, and that there are a whole variety of responders that can be dispatched, not just police and fire and EMS, but a whole fleet of community responders who are equipped to respond to the immediate crisis, but are also well positioned to do what we call second response, and to make sure that after that crisis has been stabilized, that people are connected to long-term supports and care.
Okay, we'll have to leave it there. We look forward to finding out more as you all progress in this project. Rebecca Neusteter, thank you so much for joining us.
Thank you.